idea. Right here, we are recording. I think this is of use to all of you today because you're in the process of thinking about all this. So the thing that I'm curious about is that having designed a number of treatment rooms, dental clinics for people, I know the sort of hazards and the problems. And it's not until I actually put a dental chair into a room that I know whether it fits or not, you know, on the diagrams. It's easy when you're inexperienced to look at a place and think, oh, this is wonderful. And then when it comes to the practicality of actually trying to make it into a decent clinic that works well, it becomes a problem. Some of this stuff we've been through a number of times with you, except for probably Anant. How are you, Anant? Okay?
Yes, sir.
Good, good, good. So I may go slightly fast, but I would like to send this presentation to you today or tomorrow. And
Me too, me too.
yeah, then you can have a look at it in detail because it is extremely detailed, as you'd anticipate.
These are all millimeters.
Say it again.
The units are millimeters.
It's in millimeters, yes. I'm probably like you are. You can imagine 6 feet. I can imagine 6 feet because I know a human being sometimes is 6 feet, but to imagine meters is difficult for me. But when it comes to the actual design, I mean, Siley's sent me a plan, which is all in feet and inches. So I'm having to get Alexa to translate it into meters for me. And unfortunately, I lent Alexa to somebody, and now it's come back again. Did you hear her saying she's having trouble connecting to the internet? So. Right.
Never lend your Alexa to somebody else.
Yes.
It'll always have trouble connecting.
I lent it to Sonal because her children wanted to play with it. And the eldest one is about 5 or 4. And they were having such fun with it. They were starting organizing 1 or 2 things. And their mother had to stop all her credit cards in case they'd bought things. Anyway, the important thing is to design from the patient outwards, not from the walls inwards. If you ask a designer to design something for you, a dental designer, he immediately wants to know where the walls are instead of designing it from the patient. So most treatment rooms are designed from the walls inwards, and they do this. They put cabinetry in like this, and then they put the patient like this, and right angles are not ergonomic. Ergonomics is a study of movement in the workplace. And this angle here is not ergonomic. I found this on Google, and you see that desks nowadays have round edges to them where you sit, not rectangle ones, not right angle. So compromise from the ideal and then look back to what compromises you have to make. Now, I'm sure that you probably are all increasingly working sitting down. And when I started working with some of you, you were doing things sitting up, standing up, for the reason that that's what you were taught to do and that's what you thought was the normal. So the working position, standing up or sitting down, basically, would you type standing up? Unless you needed a bit of a rest from sitting down, basically you'd prefer to do it sitting down, and certainly doing dentistry is more accurate sitting down. Now, the ideal dental stool must be easily adjustable. The height must be adjustable. The backrest must be adjustable, and it must rotate easily. The stools that I've got here are just beautiful the way they move around. And I have in the past had bad ones, and it's just a pain. It just makes your life so much more awkward. So here is an ideal dental chair. It's got the adjustable height here, adjustable backrest. It rotates extremely easily, and it's got very smooth running wheels. Planning an ideal treatment room, plan from the patient outwards. The reasons for the patient lying flat are better visibility for the operator, less back strain for the operator, reduces the operator fatigue, and it's more relaxed for most patients who don't have certain problems of age or heart problems or acid regurgitation. It's easier for the operator and the patient for over long appointments. Authentic record taking you can do with the patient lying flat, Facebook registrations, and impression taking. We've talked about this a lot. On courses that some of you have been on, you've noticed that we take the impressions with the patient lying flat, and it's only a few times that patients have a problem. X-rays also can be taken with the patient lying flat. Reasons for sitting the patient up: better conversational position. I think if you're quoting fees and discussing treatment, it's better with the patient sitting up. It's a temporary rest position for patients. Occasionally, if you've got a long appointment, it's nice to sit them up for a few minutes. When you're taking vertical dimension assessments, you can only do that with the patient sitting up. Plaque control instruction, I think you're better off doing it with the patient halfway up or almost all the way up. Sugar control counseling also with the patient sitting up, the right counseling. Appearance checking in denture construction, tip them up and have a look at them. Appearance checking in crown and bridge work. On rare occasions, after impressions have been inserted, you can then tip them up if you need to. In a year or 2 years, I might do this once. Most of the time, the patients are absolutely fine. I first took impressions with the patient lying flat because I was a house surgeon at a hospital where I had to go and take impressions for cleft palate patients for the department that was dealing with cleft palates, and they said, "Oh, always take them lying flat, even with a cleft palate." So I've always done that. For some elderly patients with heart troubles, left-sided ventricular failure, they go to sleep sitting up or tilted upwards. So they're better at sitting up a little bit. Patients with vertigo problems may need to be sat up. Patients with tinnitus, maybe. Patients with gastric regurgitation problems. I think I've come across one patient in my whole career who had that problem. Chair positions for compromised patients. Inform the patient that you're going to tip them back flat. You're then going to tip them up till they say they're comfortable. This ends up with the patient tipped further back than if you just say, I'm going to tip you back and tell me when to stop. So you end up by being able to see better, and there's less back strain for you. Now this, in fact, is my brother, and I'm asking him to tell me when he's comfortable. And I tip him back and he says, stop. So he's about 45 degrees. This would not be an easy position for me to do dentistry. So the alternative way is to tell the patient that chair will be tipped back almost flat, and then we'll tip the patient up and they can say when they're comfortable. So I'm tipping the patient back a little bit, stopping, a little bit more and stopping, and then almost flat. And then I'm going to tip them back up and say to them, tell me when they stop, when you're comfortable. So I tip him back and he says he's comfortable. Now this was where he was before, and this is where he is now. Do any of you do that? Ashwin, have you started doing that?
So no, not like this. I mean, I just initially the patient, I sit them on in the upright position, and then I tell them that I'm going to tip it back, and then they just readjust. I mean, we directly go to the flat position, and then they just adjust a little bit, and they're okay with it.
Now I'm talking about patients who don't like lying flat.
Patient who don't like lying flat, very rarely. I haven't seen.
I give them a pillow
Many patients.
if they have a problem lying flat.
Okay, you understand this principle with patients that don't like lying flat. You don't
Yes.
just tip them back and say, stop, tell me when you want to stop. Lie them back flat and then bring them back up again.
Yes. Yeah, got that,
Yeah.
yeah.
Okay. I come across patients who say, my patients don't like lying flat. And this is in the mind of the dentist, I think, rather than anybody else. Other dentists don't seem to have that problem. Now, the ideal dental chair must be really thin at the back. And the headrest must be able to be raised. I mean, for example, if I lie flat in a dental chair, my neck does not, my head does not go back as it used to. And I have to have a pillow, or the headrest should raise. You need to also be able to tilt it back so that in the upper jaw, you can tilt the patient's head back and see better. I was in Delhi at one of the dental clinics, and I wanted to adjust the headrest. It had never been adjusted. It was totally glued in. So for the upper jaw, tilt the patient's head forwards so you can see better. This is the dental chair that I have. It's got a very nice back, very nice covering on it. When you lie in this, my friend Sonal loves it. You know, he could come here and go to sleep on it. It's so comfortable. I was sitting in a dental chair the other day as a patient myself, really uncomfortable. Here's the headrest tipped back.
So did you do any modifications after getting the chair, or was it given like this initially?
This is how it is.
Okay.
Now you see Eldo, bless him, bought 2 dental chairs without seeing them. One was about 7 foot long, and it's really awkward, and neither of them are very good. But the important thing is, if you need to know what you're looking for, and if you compare this chair with what you've got, you can see where your chair is good or it's not so good. So it's a case of knowing what you need to get. Also, this chair has 4 settings on it: upright, halfway back, lower jaw position, upper jaw position. Every time you spend time pressing buttons and not keeping your finger on the button to adjust the chair, that's a real pain. X-ray position. No need to sit them up at all. By the way, Tejas, Abby's now gone on to digital.
Oh, wow. That's nice.
Well, is it? After we bought her that kit for non-digital.
You can actually use that for endo. It's got a really good endo holder.
Is it okay? Oh, you
Yeah.
can do that?
The one that we bought, Abby, that has a very good endo positioner.
For digital, you
sort of-
can use it for
What
digital.
sort of X-rays?
Not for digital, only for film.
Oh.
Only for films. Reasons for having the patient lying flat. In chairside assisted dentistry, the patient's already lying flat. Wasted time tipping the back and tipping them up again to take X-rays. If the patient has a tendency to retch, get them to raise their feet while the X-rays are being taken. I don't know why it is, but it works. Have you tried that, Anand? Or
Yes, sir.
have you tried this? Do you take X-rays at all?
Yes, sir.
Yeah. You take them with the patient lying flat?
Semi-supine, sir. No? Fully flat. Semi-supine. Halfway through.
Reasons why people sit patients up to take X-rays. They were taught at dental school. The X-ray head won't reach. Habit. And for compromised patients, then it's legitimate. Facebook taking with the patient lying flat. Again, if the patient retches, get them to raise their feet if you're taking a Facebook. Impression taking, the same thing. You've got better visibility with the patient lying flat, less back strain, reduces operator fatigue. And it's most patients are relaxed like that. If they still have a problem, take the impression lying flat and then tip them up. Might do that once every 5 years. Again, it's what you were taught at dental school. Now, designing the actual seated position for your assistant, it needs to be at a higher level than you so that she can see down into the patient's mouth. So you need a stool which can be raised high enough. So this is my dental stool, ADEC, same maker as the dental chair. it's got a ring on it for the dental assistant to put her feet, otherwise she can't reach the floor sometimes. These dental stools are terrible. What you see is this. This is three-handed, one-elbow dentistry. The video of her assisting this friend of mine doing a composite filling on this mannequin, she spends all her time with her elbow on that rest there. So designing an ideal ergonomic treatment room, we're going to design from the patient outwards. First thing to think about is the focal length. If you just put your hands in front of you and go to, just do this now, put your hands in front of you and stop at the point where you're comfortable. That's how you check the focal length, okay? Put it more down into your lap because that's where the patient's head's likely to be. So that's where you'd like the patient's head to be. So we now put the patient there. And in order for them to be comfortable, we then make it, put a dental chair under them. And then we think about the position that we're going to sit. And we could be at the 8 o'clock position, or the 9, or the 10, or the 11 o'clock, or 12 o'clock, 1 o'clock, or 2 o'clock. That's all the positions when you're sitting down that you could treat the patient. So this is a possible dentist working area. Now, as far as if you go to somebody and you stand with them and you see how close you can stand and you're comfortable. If you're too close, it's invasive. If you're too far away, you can't really have a good conversation. And the distance is ethnically and country controlled. Italians probably are happier to be closer than Swedish people. So you need to just check this. And this is what I did. And I worked out what was a comfortable seated distance for conversations. So I then measured it out and put the dentist sitting at a distance that was comfortable to talk to the patient. So this became the consultation area, and I connected it to the working area.
So how do you determine that? I didn't get it. I mean,
How do you what?
How do you determine that distance you said between the patient, that communication level with the patient?
Okay. What you need to do is to have one of your dental assistants stand and you walk up to them slowly until you think it's a comfortable distance to talk to them.
Oh, okay. Okay.
Okay, so that's the distance.
Okay.
It's similar to dining tables. Some dining tables are too wide and it's difficult to talk to the person opposite. Often round tables are too wide. Rectangular tables can also be too wide unless they are probably about 4 feet or something like that, okay? And you can notice this if you go out to dinner at a restaurant or somebody's house and notice how far the person is away from you and how it affects the conversation, okay? So this is how I came up with the pattern of where the dentist should be working when they're sitting down. Then I put the dental assistant in there and she needs to be working in this shaded area here. So we take that away from the dentist. On very odd occasions, I might have the dental assistant swap places with me, but it wasn't often. Now, I also found when I did this, I had a plywood worktop positioned next to where I was working with this area cut out of it. And I saw my first patient, and as I moved around, the back of the stool hit the work surface. So when the next patient, before the next patient came in, I took a jigsaw and cut some out. And I realized that you need this area here as a bit of extra space. Otherwise it's too tight. So I added that freedom space on so that I didn't bump into the back. And now I can move around here without hitting the stool. So this is the possible dentist working area. And then we put a table, a work surface in there. Some people might say, well, what a waste of space, the corner on the bottom left. We're not trying to fill space. We're trying to have a convenient place to work. Now, you need a carpenter to make this surface.
Dr. Eldo is waiting.
Thank you, Ashwin. Hello, Eldo. A friend of mine had a treatment room made for his clinic, and they didn't make it in this shape. They made the back of it in just a circle. And I said to him, oh, do you find you hit a chair against the back? And he says, yes. And when he was talking to patients, he was far too close. So now, when you think about the work surface height, this is the height you want it for yourself on your side. And this is about 700 millimeters high. Usually the work surface height in many treatment rooms is what height? Do you know, Ashwin, where the height comes from?
30 inches.
And why do they have it that height?
That's the dining table height.
Actually,
Kitchen counter height.
it's kitchen counter height. Yeah, because the dentist people who make cabinetry sort of learned from the kitchen people how to make it. And the width of the shelves or the doors are the width of a washing machine.
2 feet.
Or dishwasher. Yeah, nothing to do with dentistry. So this is the design which my friend Metin drew, which I think is fantastic that he did this. So that's the dentist side. And if you ever do want the information on this, I can give you absolutely, every detail, and don't bugger around with it, okay? Some people think they know better. When Ashwin, Sebastian, they had theirs made And you see the hole there, that little gray area, which is the waste bin. There was no hole there. And I put a slide in today, which says, as a dentist, be responsible for checking every dumb detail, you know, or borrow Anu, because she took all the diagrams and everything and found a carpenter to make one of these setups, and did not have a designer person, because they're the kiss of death, as Sebastian and I and Eldo came across the problems. Okay.
Quickly wanted to ask you, is the hole okay to have on the counter surface? The opening on the counter surface for the waste bin?
Oh, that's great. Yeah, because then you drop things down it.
Mhm.
So you've got a very expensive lab case, and you drop it down it. So it's I didn't even have a sink. I didn't even have a sink, because nowadays having a sink there, the amount of times you splash water around. So we had a sink at a different place in the room, or even in the next room, because nowadays with gloves and things, you're not washing your hands every 2 minutes. So you can see the curve there slowly goes away. Do not have this part, the curve, just circular. And when you do this, Ashwin, if you ever do this, you keep a complete eye on the person who's doing it. Okay. So that it is exactly this shape. What you could do is get me cut a sheet out, a cloth sheet in this curve, and then you can have it, put it on the surface and cut it out like that. So we then put a assistant's pull-out surface in front of the assistant, and then we put some cabinetry to hold this pull-out surface. You notice it's a gate away from the wall. Okay. Designer people will want to put it against the wall, but it has to be freestanding, because it needs to be closer to the assistant. So this pull-out surface then goes underneath so they can stand up. A friend of mine in Delhi has recently, in the last year, had a treatment room made, and he completely screwed it up. I think he's got a pull-out drawer, but you can't push it in without everything on the drawer being pushed off the work surface, because there's not enough height between the pull-out surface and the what's above it. So then we have another pull-out drawer here on which certain items are kept. And this space here needs to be fairly reasonable, so that you can have things on your work, the assistant's work pull-out drawer surface, so they don't fall off when you push it into the main unit. So here we have the assistance unit. There's a pull-out surface here, which is for the aspirator. Okay. I think Eldo's sitting there quite pleased with himself because this is exactly what he's got. Okay. This part of it here, where the aspirated system is, in Sebastian's, they totally screwed it up. And it just wasn't convenient at all. So he's had it adjusted now. He realized what the problem was, and about 2 years later, he had it fixed. This is the upper pull-out drawer. This is the lower pull-out drawer. And you just take a drawer down, for example, composite drawer, and it's got everything in it. So this is the drawer that comes out. This area on the left here, we use for mixing. And this is some like tile material that is the same material as the work surface is. On here, we've got cotton rolls, local anesthetic, and the patient's glasses, dark glasses. This is the pull-out drawer. Now, we've had debates, Anu and Eldo and I, in terms of how much of this stuff should be bagged. Theoretically, everything should be bagged. But I think if you go to Eldo's, some things are bagged and some aren't. People are concerned about when this is closed, can the aerosol sprays aerosols get in there? Maybe they could, I don't know. So this is the work surface, which is about 1 meter high to allow everything below to be as we want it. So then we need to add on some units if the room's wide enough. Now this is the you need to separate the dental assistant area and the dentist area. Okay, they shouldn't be walking into each other's areas unless they have to for some peculiar reason. So this is the assistant area. This is the dentist area. And these are all the positions that delivery systems can come from. And I've worked with most of these. You've got one here, which is in the dental assistant's cabinetry. And I had an extremely expensive thing called a Pelton Crane Executive that I had in Niagara Falls. And it was a real pain. Here's behind the patient. This is a cart here. And this is the over the patient delivery. Behind, these are all the different systems. And the disadvantage of this system is you have to turn your head to pick everything up. The assistant can't reach to change burrs, very inconvenient. This area here, the assistant can reach it really well. She can change burrs, she can change handpieces, she can pick up the 3-in-1 syringe. But the disadvantage is that the dentist can't reach the handpieces or the 3-in-1 syringe. And you have to turn away from the patient to see, to pick everything up. The cart here, I can even feel it now. When I got up to go and get something or whatever, I can remember now having to pick up the handpiece, which had got stuck to my trousers as I walked past. The burr would stick to my trousers, just a absolute nuisance. Some people just love it, but I want the freedom to be able to get up and walk out if I want to. Then if we come to the, the assistant has to come round to the dentist area to sort out the handpieces and disinfect and all that sort of thing. Now, this is the over the patient delivery system. The advantages are it's very versatile in the positioning of it. It can be over there if you want it. It can, and the dental assistant can bring it over to them to be able to sort out the handpieces and disinfect. Both the dentist and the assistant can reach the handpieces and the 3-in-1 syringes. Most of the time I'd have the handpiece passed to me, but then I probably, if I'd finished with the handpiece, I'd probably let it go back myself. It's very easy. And as we've talked before, I probably only use the 3-in-1%, 3-in-1 syringe about 10% of the time. The rest of the time, my assistants were using the 3-in-1 syringe. X-ray unit behind the patient here, so that but it has to be long enough. Siley, I think yours is about 20 centimeters, a bit short.
130 centimeters.
Say it again.
It's 130 centimeters.
Yeah. 140, 130.
130.
130. I think mine is about 150.
Okay.
I think. Okay. It just
Which one?
means
The length of the length. Which one, sir? Like 130 centimeter for what?
if the arm is not long enough, you can't reach the patient if they're sitting up.
Okay, I think there are two available sizes.
Yeah. Well, you need the longer one.
Yeah.
What view does anybody have on these portable X-ray systems?
I love them. I'm planning to buy one.
It's like being in love with a woman until you marry her. It's in your heart rather than in your practice. You haven't actually used one yet.
I wouldn't think of why it would be a bad idea.
I would say it's a bad idea because if you take a different example, you'll probably see a bit later where my tissues are and my my gauze are in a container. They're always in the same place. I go to clinics and I want some gauze and they take it out of a drawer. The tissues are in a packet, which could be anywhere in the room. Whereas if you've got the X-ray unit there, it's there every single time you want to use it. Now, from a convenience point of view, and what we're looking at here is the ideal. What we're looking at from a convenience point of view is, say, for example, you've got 2 rooms and you've got 2 X-ray units. That's the best thing. Okay.
Also, one more thing is like you're so close to the head. You know, I mean, each time when there are sometimes when the patient cannot hold the X-ray or for some reason you need to hold it, especially for endo cases. And as soon as the button, the beep sounds, I just get a small 5 seconds of headache each time I'm being exposed. But on the other hand, if you're like 6 feet away, you don't have that issue. So each time you're holding it in your hands,
We're talking about a different subject now.
Get a positioner.
We're talking about the position of the X-ray machine.
No, what I'm saying is about his idea of buying a portable X-ray machine, holding it so close. I mean, you're always holding it,
I
right?
can't rationalize. I can't rationalize.
It's portable X-ray is DC X-ray. It's not alternating current, unlike the wall mount. So the radiation levels are probably 1/10 of a regular wall mount AC
I'm
current.
pleased about, yes. Yeah,
Second is if you're someone like me who has to go to the operating room for general anesthesia and things like that, it would make a lot of sense to have a portable unit.
yeah. The answer is to have both. Anyway, what I'm interested in is you're all thinking and working out which is the best to do. Okay, seeing all the possibilities. So here's the X-ray unit. Okay, the ideal place. And don't just let the company stick it on the wall. You tell them what height you want it to be. $1,260 mm, okay, Siley? So this is my unit. Aspiration, just here. This is absolutely super. I've had them before in different positions, and they were just, you couldn't reach them, as I'll show you. And it pulls out nicely, so you can, it's closer to the patient, then you can push it away. And the dentist and the assistant can both reach it easily. You need high velocity suction. The air travels very fast, and it collects spray and aerosols over a longer distance than a high vacuum. The high vacuum will pull a lot of water out of a bucket, but if you bring it away from the surface of the water, it won't pull any suction at all because it's high vacuum. So it's the high velocity is good for restorative dentistry, and it's good for oral surgery. The high vacuum is good for oral surgery, but it's not good at all for restorative dentistry. Linear treatment room, ideally, the practice is built so the treatment room is the ideal size. The ideal size is about this size. This allows for space at the treatment area and for a chair for accompanying persons. When I came back to England, I'd always had children come in by themselves. And when I came back to England, I decided that I'd have the parents in the room. So if the child starts making a fuss, they're in the room and they can see the child making a fuss. Whereas if they're in the waiting area hearing their child screaming, they're assuming that I'm torturing the patient.
What if the parents start making a fuss and the children
Yes,
is
sir.
all
Many
right?
times. Yeah.
Yeah, that
There's
happens a lot.
Well, you have to deal
protected
with that
parents.
too. But
I have
mean,
a camera, and the parents sit outside watching a screen. What's happening inside?
I like them inside so I can chat with them.
They're annoying. They ask you all sorts of questions.
Well, that's all right. That's fine too. And I think the children behave better as well. Anyway,
It's fine
just,
to charge by the hour. You can answer all the questions.
that's fine. So if you can have a room which is this long, that's fantastic. Otherwise, it's adequate to be about that. I think yours is about that, Eldo.
Yeah.
Yeah.
Correct.
And this wide. One of your rooms, Siley, is just bigger than this, which is great. The other one is difficult. So here's the dental chair. This is the curved dental assistant.
I don't think you should require a bigger size than this for a dental room, for a treatment room.
Well, if the room's there, it's nice. You can have storage in there if you want to. If you've got the room to do it. It's more room for patients to, you know, accompanying people to sit. No, I think it's nice. You can even have a desk in there, Eldo, and you can sit with patients if you want to. So this is the assistant's cabinetry. Accompanying people. If that's not possible, you can get away with that, which is what Eldo does, okay? Planning treatment room in an existing room. Now, Saidi, I do recommend you do this, okay? You get yourself accurate measurements of the room, which you've done. A floor plan that's 1 to 20 scale. A measuring tape, a scale rule, and a celluloid template with a plan on it, as I'll show you. And you need a ruler like this. And I don't think you should just leave it to the designer people and the carpentry people. You need to check it yourself.
Okay. Is that a special scale where do I get it from? What is 1:20 scale?
So where do you get?
Yeah, the scale, what is it? 1:20 means I didn't understand.
So you ask the question again.
This scale, is it a special scale, 1:20? What exactly does it do?
Scale rule.
When you've got your plan, which is quite a big sheet, 1 to 20, you can then take this rule and just be able to see, when you put it onto the sheet, you can immediately read how many meters it is wide. I think you have to have one to be able to, on a sheet, to be able to understand that, okay?
Okay.
So the dentist should be responsible for the correct construction, okay, of the treatment room. Do not trust designers. They do not understand the accuracy of the design we're talking about here. Okay. They mess around with things. That's why Anu did a great job upstairs at Eldo's, getting 2 rooms done that are just very nice. So you need this celluloid sheet, and you take the diagram of the room and you put the sheet on there, and then you move it over like that. And then you think, oh, that could be a good place to put the chair and the cabinetry. Factors affecting the positioning of the template when you're doing this, you need to know where the doorways are, the windows, and the traffic flow, which is the movement of the people involved, as we'll look at. So it's the paths that each relevant person use when entering and leaving the treatment room, as we'll see. The patient, the dentist, and dental staff. The paths traveled by the relevant people should cross as few times as possible, so that there's less confusion and bumping into people. So the dental assistant should not need to come around to the dentist area, and the dentist should not need to go around to the assistant area, except in exceptional circumstances. So looking at the traffic flow by the dentist comes in like this and goes out like this. The assistant comes in, the patient comes in like this, and the assistant goes around like this. The only area where everybody might conflict is at the doorway in this situation. So when the dental assistant comes in and the dentist, when they walk out again, the only place in this room they have a conflict at the door. Now you can solve this problem by putting two doors in, if that's possible. Okay. Then there's no conflict. Left-handed dentist, you just take the template, you turn it over and move it round. One of my friends is left-handed, and he used this system. So you might be interested if you draw your treatment rooms and you draw the traffic flow and see how it is at the moment.
It is a spelling mistake.
Let me
Draw
in.
the traffic.
Sorry?
It's draw the traffic flows, right? It's written draw the traffic flows.
Okay, thanks.
Let me in.
So Tejas is trying to join.
Okay.
Tejas is trying to join through the phone, I think. Yeah.
Oh, hold on a minute. Right. I'll correct that later.
Sure.
Ah, yes. So we need to look at doors, windows, and the traffic flow. If there's a window here and you put the template on like this, if you wanted to put an X-ray unit here, you can't because of the window. This is where if you've got a portable machine, that would be helpful. Also, the cabinetry gets in the way of the window. So we rotate the template round like that. But then there's a problem getting into the area because there's a conflict here where everybody crosses over. So the answer is to move the cabinetry back to here for the assistant. And the dentist goes around like that, patient like that, and the assistant's like that. And the only place of collision is at the door here. If there's another window over here, so there are two windows, you might turn around like this. The only disadvantage with this is that on the left-hand side there, where you've got the the dental assistant's work surface, the long one, you could, if there wasn't a window, you could put some cupboards on the wall above. The other thing about it is that the traffic flow is a bit of a problem. The patient comes along like that, and then the assistant goes round like that. And so there's a conflict here and here and here with the dentist and the assistant, and then they spread out. And then when they leave, there's a possible conflict here. Now this probably didn't worry Eldo because he's got some nice attractive assistants and he probably likes to bump into them. The other thing is you can move the door, okay, in which case the only area of conflict is just here. Left-handed design, you can just turn it over like that. The assistant side cabinetry would have to be against the wall at the top there. Otherwise you couldn't get into the area. With a narrow room, put the template on here, and there's not enough room for the extra work surface area for the assistant. So you remove that and put it over here. Okay. Just letting Abby in.
The work surface of the assistant, which you just moved, is that the cabinetry? The work surface that you just moved for the assistant, that's
Yes.
not the cabinet, right?
No, that's an extra place for her to store things and put things, and maybe her sink could be in there, okay, as well.
Okay, but it's just a counter with nothing, no drawers underneath.
Oh yes, yeah, you use that, usually cupboards, but you could have drawers as well.
Usually covered. Okay, okay.
You could have a drawer there that contains surgical instruments and things. Okay.
Okay.
Now, don't make the mistake of having a door opposite the end of the chair, because anybody walking in can look straight up women's skirts, and some women don't like that. So in a situation like this, you'd move the door to one way or the other. Now, I'm just about to show you a picture which you may have seen before, where they made that mistake. And this is in Abu Dhabi, where they've got plenty of money. And they made this mistake. And in the first day or two, women started complaining because the door was opposite exactly the end of the dental chair. So it's absolute insanity what they did. And I don't think the dentist complained. I mean, how can you do dentistry in a room like that? Just awful. Anyway.
Where is the door in that? I couldn't see the door.
At the doors where this arrow is.
Okay, but the woman is, her head is coming towards here. So what's the problem? If her leg is coming in this way, then it's a problem.
the dental chair was not this way around.
Oh, you made it, you rotated it.
Sorry?
You made them rotate the chair like this now.
No, that's how they turned the dental chair round like this.
Okay.
Originally, the feet were facing you here,
Okay.
and they just turned it round.
All right.
Okay, so if you put this dental chair flat, where's the assistant going to have the instruments to pass to you?
Yeah.
Okay. And the sad thing is that the dentists didn't immediately object what they'd done. They should have moved the door, or they shouldn't have done it in the first place. Okay, just dreadful. I mean, looking at what I've been showing you today in terms of the design, Eldo, you'd be tearing your hair out if you had to work in this room. You just, oh, dreadful. Also, you see another dreadful thing here. You notice the hanging cables,
Yeah.
okay, which run all the way. When they're over the top of the patient, it's not pleasant for the patient. Okay, designing dental practices. This is the work that I did with Siley on previous designs. So here we've got, it's on the ground floor, which is good. Okay, you want a clinic on the ground floor or with a lift. Okay, for people in wheelchairs or old people, because in India the life expectancy is getting higher and higher, isn't it? So you can have more and more people in wheelchairs and old. So the fact it's on the ground floor or you've got an elevator is an important factor. So that's good for disabled people. I've added a scale in the bottom there. So I can now, this is the main room. This is the size of it. And I changed it into meters. And these two rooms are pretty small, as this one is as well. And there's a toilet lobby area here. And there's a window here affecting our positioning. So I put this on here like this. It doesn't allow good use of the rest of the space. Now I put it here because I was hoping that that center wall there could be removed. Now that's looking pretty good because then there's a good area here for the reception and waiting area. There needs to be a partition here so that people can't look up women's skirts. The sterilizing area here, there's good. And there's an office waiting area here. Still, this is quite small. This is another design we looked at. There was a balcony here. I tried putting the template here, but it was difficult because there's a window here. So this would be quite a good plan. Now, if you move the door down here like this, you can then put the other work surface for the assistant. I should have moved the sink down because you can't reach it there at the moment. I need to move that down. What you can do is move that down there and put a treatment room in here. Then you put a door in here. This can be the sterilizing area. If you put a door here, this could produce a certain amount of confusion if two people are using both doors at the same time. So you can move the door over here. Okay. I told Siley to go to a new place and check which walls were solid and which walls were partition walls. How would you check the difference, Ashwin?
Knock, knock.
Yeah, absolutely. And then you make a note so you know which walls can be taken down. That's it.
Can she add one more chair to this room, this clinic?
Very difficult. Very difficult. You see, Ashwin, if you've got a plan that's a scale plan and you put the template on top of it and move it round, you can see where it's possible. You know, if we took that scale plan that you're looking at there and move that into this room down below, you'd find that there's no room around the chair. You might have it diagonally, but then you see at the moment, you've got a sterilizing room here and you've got a waiting area and a reception area. Okay. If you tried to put a treatment room in that room below here, where are you going to do the sterilizing? You have to
So what are these two small rooms adjacent to the treatment room area? I mean, yeah, those two those two where the point is right now.
I think one is a toilet. I think one is a toilet. The other would be storage.
Okay.
You see, you need a treatment area. At the minimum, you need a treatment area, a reception area, a waiting area, and a sterilizing area.
Can we
And
club the reception area and the waiting area? I mean,
sorry,
can we club it? I mean, can we club the reception area and the waiting area
that's what you do here.
and make it a little?
Okay, that's what you do here.
Okay.
You've got a treatment room, you've got a sterilizing area below that in this diagram. And you've got a waiting area, reception area. And you've got two rooms there. One's a toilet, I think, and the other one could be used as a lab. Okay.
Lab, yeah, yeah.
Now, I think that Elder would tell you that having a waiting area enclosed like he has, it's much nicer. Patients can go in there and relax in that room. The receptionist is not talking about fees and things in front of the rest of the patients.
Ah, yes.
You see what I mean? Which is what you have at the moment, don't you?
Yes.
Yeah.
Stuart, how do I get the template?
You speak to me nicely.
I am speaking to you nicely. What I meant is, can I print it off on a celluloid, or do I need a particular setting for it?
I'm not sure at the moment. I need to get together with my designer man and just confirm everything's correct. And then I can
Okay.
either send you, yeah, I'm sure you could print them off if you get the celluloid.
Okay.
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 Just one moment.
Abhi is looking really different today.
How, sir?
Looking better. Always we used to see you in uniform.
Yeah, I came home early today for the class.
Okay, very good.
Tejas, this
Yes.
is one of those sheets, okay?
Okay.
All right.
Is that like what size is that?
This is 1 to 20.
No, what I mean is that like an A4 paper? A4 size or?
No, just 1 second. This is A4. Okay.
Okay.
So it's you can probably get 2 out of 1 A4 sheet of celluloid.
Okay. Okay. All right.
Ali, can you see this? This is one of those plans. Okay. This was Kavitha's plan, okay? We did. This is Sebastian. Okay. I give the measurements to a friend of mine who draws them up. That's the most accurate way of doing it. Okay, here's another area. These are areas which all areas which Siley sent to me and was trying out to see if it's going to be suitable. So you put the template over like that. Now, Eldo, you'll be interested in this particular design. You see there's a lot of space there in this room at the end of on the right. Okay. What you can do is to move this unit like this and then put a sterilizing area here. Then you've got this room here for a greater space here for reception. And you could even have this as a storage or business area.
Yeah, that's a good idea. But
Yeah.
the problem is you need to construct a wall here for this to hang on.
You have to what?
You need to construct a wall.
No, you could put a steel thing up. Okay, what to attach the X-ray unit?
So even the cabinet has to, has to hang on something.
What, the cabinetry?
Yeah.
No, it's on the floor. Uh, it's on the floor.
Okay,
It's freestanding.
okay.
The only thing you have to do is that you need some sort of girder attached to the ceiling to hold the X-ray. That's the only problem. But I mean, even in this space here, even doing this, you're still pretty short of space. When you start thinking about storage of dental supplies, paper.
So you can use the lab for that. I mean, a portion of the lab by having
Oh, yes.
hanging
Why do you need
cabinets.
2 rooms here?
Sorry?
Why do you need 2 rooms here?
Why do you need 2 rooms? How do you mean?
No, see this. This is the entrance, and you come down here. This is the patient waiting. This is the patient waiting room.
It could be, yes, waiting room, yes. And then you've got a separate, but you don't have a business area or a storage area. You come and try and use it.
No, no. Why did you put 2 doors here? What is the intention of having these 2 separate rooms here? What is there in your mind?
What separate rooms are you talking about?
So just, I think the room that has the arrow in it. What room? What is that for?
It could be storage and business or waiting area.
Okay, so if this is waiting area, then what are these?
What is what?
What is this? Where my mouse is? Oh.
No, sir, we won't be able to see your mouse. We won't be able to see.
I was thinking, why he is not understanding this?
You're talking about this area here?
No. The one in front of that.
The one above it?
Yeah.
That's a little storage area.
Okay.
And then the one above that's a toilet.
That's a toilet.
Yeah.
Okay. So the one with the arrow now is what?
That's the reception business area.
Okay. So she'll only be having 1 treatment room here in this place. So can we somehow accommodate 2 chairs here?
Eldo, you're going to have a receptionist and you're talking about one dentist having, well, Eldo, if you had this diagram, if you had one of these diagram sheets on the table and you put that, you took that template onto you can't, it doesn't fit in that top room.
Okay.
But if you put another treatment room there, you can need another assistant. You've got the dentist, you've got 2 or 3 dental assistants and the receptionist and patients. Really crowded.
This is Sally's design. Sally's place.
This is one place she looked at.
Okay.
Okay. Now, here's another room. And you can put the dental chair in like that. And you've got a reception waiting area here. And you've got sterilizing storage room here. Now, you could put a treatment room here. But then with this design, you don't have a sterilizing area. And the waiting area, you see again, Eldo, in that room on the right there, on your diagram sheet, you'd have to put in chairs, tables, desk, and see how small it is. It's not a big area. Now, there is an alternative, moving this like this, and then like that, and that gives a waiting area, possibly, but you could also possibly do that. Eldo, then you've got the problem of you need to move the door there because that's right in front of the patient's skirts.
Yeah.
Also, the assistant would have to walk through the treatment room to the sterilizing area. But now you've got a situation where you might have a patient in each of the rooms. You might have an accompanying person in each of the rooms. You've then got the next patients arriving, and you've got a small reception waiting area. It would be so congested. And
What
when
if
the patient's in the treatment room? Sorry?
What if we can, where those arrows are in between, that is the pathway towards the sterilization room. Can we conceal that space? I mean, like, can we make it like a corridor?
You could do. You could do. But then, do you understand the volume of people in this place?
So we can just shift the room one or two a little more towards the top. Then we can make a little more wider corridor, a little more.
We're assuming that this is the outward, the outer size is how it is.
Okay.
Okay. Otherwise, but I mean, you'd have to think of in the waiting room, you've got the receptionist, you've got 4 people waiting for their next appointment, or rather 2 patients waiting for the next appointment, and they've got 2 people with them. And then you've got 2 patients in each, 1 patient in each room with their extra person. It would be just a nightmare.
So I'm like, even if the second chair is not fully operative, the need for a second chair is very important, because anyway she's going to be here for a long time, and if another patient comes, they'll be waiting all the time over there outside. At least if she could just see the patient and send them off or something, always a second chair is a good thing, I would say.
Okay, so in that case, Ashwin, you don't choose this area. If that's important to you, you don't choose this area. You don't choose to have your clinic here.
Okay.
If it's important to you to have 2 chairs. Okay. Now,
So with this design, where is the X-ray hanging? Is there a wall between the, between the sterilization room and the chair room?
where would you put the X-ray unit?
X-ray, yes, sir.
You'd have to have a support. Okay, you'd have to have some sort of iron support or hardwood support that's attached to the floor and the ceiling.
We get floor mounted X-ray machines also. That could be a good option, isn't it?
You mean a walkabout X-ray machine, yes. Okay. Now, this would be an absolute nightmare. Okay, in terms of the reception area is very small, in fact, and having patients in there as well, you have to think about the numbers of people. Now this one has a larger room next to it, okay? So you could put one treatment room here. This is a larger waiting reception area, or you could have the reception area here. Or you could have this as, this would be the sterilizing area, in fact. And this would be your reception and waiting area. The alternative is to move this forwards like this and have the sterilizing area there. And you could then do this. But then you've got an extremely limited area for the waiting area. It would be good if I put some chairs in there so you could see. Fortunately, I think that's come to the end. So what time is it now in India?
9:50, 10 minutes to 10.
Ah.
What is the place as a common toilet?
Well,
Meaning
that's
the building has a common toilet.
that's a disadvantage than having your own toilet.
That is true.
I mean, a common toilet, who's going to look after it?
It's a problem, especially in India. Common toilets are a problem.
Yeah, yeah. I met a woman, an American woman in Nepal, who had developed a very bad gastric infection. And she was so bad, they put her into a hospital, which was a maternity hospital. And she said the toilets were locked. Can you imagine?
Oh, when we are doing post-graduation, well, our toilets, we didn't have toilets at all for postgraduate students. And there were 2 toilets only to be used by the professors. Students, there were no toilets. So once somebody went in, and that became a big problem when they went into the professor's toilet. So we had to fight it out without, any answer to it. We couldn't find a good toilet for us in the postgraduate department. So pathetic it is. Toilets are very precious here.
There was one place.
In my current place, I had a shared one, and now I have 4 in the new one. Too much.
Say it again, Sally.
In my
She's got
existing
4
clinic,
toilets
I
in the
never
new
had.
setup. She's got 4 toilets in the new setup. Sorry.
4 toilets in the new one.
Yeah, too many.
I didn't see them.
I
Can you
will
make a
send you.
note?
I'll number them.
Yeah,
Yes.
do. Yeah.
Four
Um,
toilets, four toilets provided by the building owner in the same floor.
So it's an apartment. It's a 3-bedroom hall kitchen with a pantry, all. So it's an apartment being converted on the first floor on a main road, which can be converted into a dental clinic.
Okay.
I was in Kathmandu, and I gave a course on a 2-day course on this sort of thing. And this was in a dental school. And I went to the men's toilet area, and there were no seats. And half the toilets were squat, and the sinks didn't work. So I went to the toilet, I came back into the room, and in front of everybody, I took some a water bottle, opened the window, and washed my hands out of the window. Dear, oh dear. And some of the toilets in some of the dental schools I've been to, absolutely disgusting smell. The that was silent. Oh, thank you.
Nepal International Airport was stinking.
Was it?
My goodness. And dogs were running inside the airport. Stray dogs.
I used to give a lecture, and the idea was that if you raise your standards considerably, and you've got an established practice, if you raise your standards considerably, what happens to the patient appreciation?
Rises.
It goes down considerably, because you take longer to do the job. The after discomfort is probably greater, and you're going to charge them more. So if you decide to raise your standards tremendously, you have to counteract this inconvenience to the patient. And the first thing you do is go into your toilet and look at it and see if you can upgrade it tremendously so it's wonderful. You then upgrade your entrance and your waiting area, so that the patients increasingly think, what a nice place it is. I have a collection, which one of you might have known about, of photographs of sinks and toilets and urinals, which I've collected. I've got about 500 pictures.
Toilets, sinks, and water.
Toilets, urinals, and sinks from around the world. And some of them are absolutely beautiful. Just the design that they put into it is just lovely. And you know that if you go to a restaurant and you go to the toilet and it's really nice, that's uplifting. But if it's really crummy and smelly, it puts you off.
True, sir. Absolutely true.
Say it again.
Absolutely true, sir.
Yes. Yeah. Yeah. Now, next week I have a problem because I have a dental appointment at 2:30 our time, which is 7:30 your time.
Dental appointment for what?
So which dentist you go to?
A friend of mine that I taught. He's a good friend of mine. I once needed a gold onlay. So I had him here for a day and I taught him how to make gold onlays. He prepared gold onlays on natural teeth. He then came here and prepared my tooth, took an alginate impression, and we poured it in temporary crown material. And we then looked at it and we could see where it wasn't correct. So he then made the adjustments, and we took another impression and looked at the model, and he made 1 or 2 more corrections, and then he took the impression. Did I ever tell you about my orthodontics? I'll tell you. I had a lateral incisor taken out when I was about 12. I went in to have my tonsils taken out. My mother, who was a dentist, said to the surgeon, "I wonder if you take out a deciduous lower molar." But he also took out the lateral incisor and the upper as well, because it was a bit loose, because I'd had it hit by a cricket ball. Now it's bad enough if it's on anybody, but if it's the son of a dentist, she was extremely polite to the surgeon afterwards. Anyway, my upper and lower teeth were crooked for many years. And I was looking at myself in an aircraft, and I thought to myself, I really ought to get these teeth straightened. And I was 64 years old. So I was running a year course where the dentists came, about 5 or 6 or 7 of them, once a month. So I taught them how to do painless local anesthetics. And I chose the student who was the most gentle to give me the mandibular blocks, because I was going to have 2 lower premolars taken out. And I chose a Scottish man to pull the teeth out, but Scottish dentists pull more teeth out than English dentists. So on one day they pulled 1 premolar out, and on the other day they pulled the next premolar out. And the next day, a friend of mine and I taught them how to put brackets on. So they all put my brackets on that occasion. And then when they came back a month later, they took it in turns to take the wires off and put the next wires on. And over a period of time, by the time it came to the last appointment, the last visit of the 10 monthly visits, they took all the brackets off and took impressions for the spacers. And they then put on the lower and upper twist flex retainers. So I had my dentistry done, and I didn't pay for it, but they paid me for teaching them how to do it. I tell you, it was a very funny feeling, or it was a funny time when I first sat down in the dental chair and I said, "Right, now go ahead." And they all went sort of, they were treating sir, you know. Ooh. Okay, so now then, if I'm lucky to get my COVID test and everything done, I hope to be leaving for the Caribbean. And I shall have to reassess the situation when I'm in the Caribbean, if I get there, as to what the time changes are. So I'll have to get in contact with you then. What you could do for me as well is think about what things you'd like me to go through. I chose this today because Siley wanted me to do it. We might get into implants and things, which Ashwin would like, I think.
Yes, I would.
Okie doke. Say hello to your,
Thank
say
you.
hello to your son for me. Hello. Hi there. Okay, so
Just a second, I have something to tell.
yes.
Yesterday, there was a lipoma on my hand, so I went yesterday to a surgeon to remove my lipoma here. So these surgeons are very ruthless in injecting. So what I did is I made my dental assistants who have no formal education in injections. So I made them give local anesthesia around the lipoma, and then went to the surgeon to have it, to have another, his session of injections later, so that, it was absolutely painless when they did it to me.
Cool, sir. Nice.
I have a story as well. I had a cyst in my sty, in my eyelid. And I went to see this eye surgeon who hurt me like anything, taking it out.
Okay.
Local anesthetic, everything was painful. So the next time, about 2 years later, I had another one. And it was caused by acrylic when trimming dentures. So this time I was being seen in a hospital, and I took along my jet injection, needleless injection system. And I was being seen privately, not under the National Health Service. And I was sat in a corridor, okay? And the door at the end opened and somebody said, "Mr. Orton-Jones," and then they went back into the room again. So I got up and I opened the door, went into this room, which was an operating theatre room for minor operations. And I was attended by, I was unattended by about 6 or 7 people. Eventually, the house surgeon suddenly said, "Oh, Mr. Orton-Jones." Okay. And he started to be nice to me. Anyway, I lay down on this operating table, and I explained to the surgeon beforehand how to use the Sirijet. And I cocked it for him and told him where to put it. And I felt a little smack, that was all, in my eyelid. I then engaged him in conversation for about several minutes to stop him from going in there too early. Whereupon he brandished the needle right in front of my eyes as he prepared it. And he then gave me the local anesthetic, and I felt absolutely nothing. And the whole procedure was completely painless. And afterwards I said, "That was really good. That was really painless." He said, "Yes, we don't really think about things like that." Bastard. God, dear, dear. Eldo, when do you get the biopsy back?
Say again?
When do you get the biopsy back to tell you that it's cancerous?
It won't be cancerous.
Was it biopsied?
Yes.
Yeah. You start smiling when you get the result back, mate.
Oh, yeah, absolutely. You can have a rum on that occasion when I disclosed it to you.
One last story. I had a split upper premolar. I couldn't understand why whenever I ate, it hurt like anything. So I went into my practice and I'd got a delightful dental assistant who was at least 17 years old. And I said, I lay down the chair and I said, right, this is how you use the local anesthetic syringe. And put the surface anesthetic on the cotton roll. And then she waited a few minutes. Then she put the local anesthetic in. And then I said, forceps? And she looked at me. And she got the forceps and took out the broken bit.
Yeah.
Oh dear. My grandfather took out a lower baby tooth using ethyl chloride spray
Okay.
on the tooth. That was sort of routine. I once used ethyl chloride spray on a patient at dental school for some reason, and she had a swab in her mouth, and the spray went onto the swab, and I could swear that she went unconscious for about 3 or 4 minutes. He wasn't responding too well for a little while.
All right.
Okay
sir.
then.
Yeah.
I'll be in touch with you all as soon as I can arrange the next thing, but I could go through anatomy as well sometime. So if you come out with any suggestions what you'd like me to go through, it's a considerable help to me because this presentation I've spent about a week on, the one we've done today. So it's much improved because of me having to show it to you today. Okie doke, I will look forward to seeing you sometime.
Yeah, good
Hopefully
night.
in 2022.
Hopefully, yes. Hopefully, yeah.
Okay, cheers then.
Okay, sir. Yeah. Cheers.
Bye then.
Carry
Okay,
on.
thank you.
Good day.
Bye-bye.
Good day.
Bye-bye.
Bye-bye.
So,
Why 2022?
Well, not this year anyway.
Ah, okay. See you means in India, right?
In India, yes.
Okay.
But it may not be, may not even be next year. I don't know. When will India be safe?
Okay, sir. Take care.
Okay, bye
Take care
then.
of yourself.
Nice to see
Bye.
you, so, Abby.
Same to you, sir.
Look through the video when I send it to you, okay?
Yes, sir. So have we haven't completed the complete dentures.
I think we have.
So we have completed the existing one. The people we having the existing denture, the labs.
Oh, what about, I could go through when you don't have complete denture, when the patient
Correct.
doesn't have any.
First time. Yes, first time.
Yeah.
Yes.
Okay, I have a way
We are
of doing
left
that.
with that. Yeah. Yeah.
Okay, remind me to do that one next time as well.
Yes, sir. Okay.
Okie doke.
Okay, sir.
Yes, then.
Take care, sir.
Bye.
Bye, sir.